Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. In this video, I will talk to you about hip replacement for AVN of the hip joint. AVN is a fairly common problem in the hip joint that we see in India, especially in the younger population. So, this progresses through stages. AVN means avascular necrosis, or the blood supply to the ball of the hip joint is reduced or lost. When this happens, it progresses in stages. Firstly, pain happens, and then over time, if the condition is not halted, then it progresses to something called collapse, where the shape of the ball of the hip joint changes. Till the time that the ball of the hip joint is intact, meaning shape has not changed, we can manage with medicines, or we attempt to maintain the shape through a procedure called core decompression and bone marrow injection. Until this stage, until the shape that the ball shape is maintained, we don't need to do a hip replacement. However, if the condition has progressed, meaning the shape of the ball of the hip joint has changed, we call it as femoral head collapse, meaning the shape has collapsed. Once this has happened and it is painful, then it is generally not reversible or maintainable. It generally progresses slowly over time and gives rise to more pain and arthritis in the hip joint. So, if collapse has happened, the ball shape has changed, and the patient is having significant pain with activities of daily living. Generally, if they are not able to walk more than 15-20 minutes, they are not able to carry out their activities of daily living, or they are requiring frequent pain medicines, then we take these people for hip replacement procedure. We call it a total hip replacement because we replace both the ball as well as the socket. This is needed in younger people to give them maximum pain relief and a long life for the hip joint. So the thing about avascular necrosis or AVN is that most of these people are relatively young, not like patients with hip fractures who are like over 70 years old. These are generally in their 30s, 40s or early 50s, many of them. So for hip replacement in such people, we are looking at a hip replacement procedure that will last as long as possible. On an average, a hip replacement would last about 20-25 years with proven results. Now the efforts are to increase the longevity to about 30-35 years. So we have two things that we are doing in this regard to give a hip replacement that will last longer than the standard hip replacement. So one of them is the material of the ball that we use. Earlier we used to use metal balls. Now we are using either ceramic or oxynium balls. Oxynium is a ceramized ball. Both of these are used in conjunction with a highly cross-linked polyethylene, and this has very good results. So the ball material has improved over the last 10-15 years. We have moved away from metal balls to ceramic or ceramicized balls, and this we expect to increase the longevity of the hip joint. The second thing is the accuracy of the surgery. The angle at which we place the socket, the accuracy with which we restore the leg length, both these can affect the long-term outcome of a hip replacement in terms of how many years it will last. We want to get the socket exactly in a certain angle, roughly around 40 degrees is what we aim for. With manual technique, it can be achieved in many patients, but some patients it is not reproducible just by surgeon alone. It is like manual accuracy is only limited even in the best of surgeons, best of hands. So we now use robotic assistance for achieving exact cup position. We are now doing robotic hip replacements in which the socket is placed under the guidance of a robotic arm. The surgeon places the cup, but the hand is guided by the robot. So when we use robotic technology, we do a CT scan, plan the surgery and get the cup position exactly where we want it within a few degrees of accuracy. The main aim is to avoid it going beyond 5 degrees. With robotic technology, we are able to get it within 5 degrees accuracy in almost all the cases. Also, we are able to restore the leg length exactly equal to what it was before the pathology or the avascular necrosis happened. This also is done within millimeters using this robotic technology. AVN hip replacement is required when the shape of the ball has changed. This is we call stage 3 or stage 4, and the patient has significant symptoms. These patients are young, so we are looking to give a hip joint that will last a long time. This is done using ceramic or ceramicized oxynium balls, and the robotic technology for surgical accuracy. Thank you.